everybody, how are you? How are you doing today? Welcome to Nurse Blessing Care Corner, where your health and well-being is always our top priority. This is always brought to you by White Dove Health Agency, a home care agency that provides everything you need for home care services with nurse care management. Today is a special day. Outside being a nurse, which I love, and educating our community with some educational materials, I'm also a CPR instructor. For those of you who are out there who don't understand what the CPR is and how to do a CPR, make sure you're contacting White Dove so our instructors can impact the knowledge that you need to save a life at a time of emergency. Today we are going to be talking about blood pressure, understanding blood pressure, and simple guide for my seniors. Have you ever been told you have a high blood pressure, but you don't fully understand what that means? Maybe you've been feeling so tired, so weak and dizzy, but you don't know what exactly is happening. You're not alone. Managing blood pressure isn't as complicated as it seems, and today I, Nurse Blessing, will help you understand it in the simplest way possible. Okay, so why does blood pressure matter? Why do we really need to pay attention? And what are the easy steps we can take to keep it in check? I promise you, if you stay with me, you will be motivated to take control of your health. Blood pressure. Blood pressure is the force of the blood pushing against the walls of your arteries as your heart beats. Picture it like a hose, like when you open the water, when you want to water the garden and flowers, that force that comes out, that's what we kind of give you a picture of what's happening with your blood pressure. When we talk about blood pressure, we use two numbers that we want our patient or individual, you, to understand. You have the top number, which is your systolic, when your heart is beating, and the bottom number, when your heart beat is at rest. The number we like to see when I'm out there doing assessment on you is 120/80. But when it's higher or lower, that can be a sign of something we have to pay attention to. And you know, a healthy outside starts from the inside. Okay, why blood pressure matter? Why does it matter? And how does blood pressure actually impact our life? Do you know that 1 in 2 adults in the US has high blood pressure, and many don't even know it? High blood pressure can be silently harming your organs, and this can lead to heart disease, stroke, or even kidney damage. That is why it has that famous name, the silent killer. We had an individual that reached out for us for home care service. When I went out there to do an assessment on him, this individual blood pressure was 190/105. He never even knew he had a high blood pressure. Matter of fact, it was almost arguing. I had to do the blood pressure check 3 times because he was shocked that he actually had such a high blood pressure. So we were able to call the doctors and implemented the right process with the doctors, and the doctors, putting him on the right medication and doing the changes of lifestyle, his food, exercising. You'll be amazed when it comes to exercise, and it doesn't have to be intense. Today, Jimmy blood pressure is better monitored. And the flip side, what about hypotension? When your blood pressure is low. When it's low, you can also feel dizzy, you can also feel weak. So knowing your blood pressure and taking accountability of knowing how to measure and keep track of your blood pressure is extremely very, very important. What are ways that we can help when it comes to blood pressure? You want to eat the right type of food. You want to stay away with food that is fattening and all those fast food that we always go to. You want to eat food that will actually nourish your health, because you know the food you eat is the medicine to your body. Another thing I educate most of my patients is learning to relax. You'll be amazed what stress does to your well-being. It adds no value. If anything, it causes more aggravation to your life. Now you know what blood pressure is and the numbers that we're looking for. Take control of your health, because you know this body is the only housing you have to live. Again, thank you for tuning in today on blood pressure and how to manage it. This is Nurse Blessing Care Corner. Your health is always my ultimate goal. We'll see you next time.